incidence of CKD in developing countries, and CKD is projected to become the 5th most common cause of years of life lost globally. The burden of kidney disease, premature mortality, disability, reduced quality of life, psychosocial harm, high cost to the governments, high cost to individuals and families, which is so true in India. Now, this was not the case when I was working with the National Health Service. I'm going to talk briefly about my experience there and what I'm doing here. So this is all about the geographical and predicted years of life lost from CKD. And people, the awareness of CKD is alarmingly low. Worldwide, only 6% of the general population know that they have CKD or what is CKD. So risk factors of CKD: environmental, climate change, extreme heat, nephrotoxins, obstructive nephropathy, acute kidney injury, genetic cause of CKD, glomerular disease, infectious disease, poverty and malnutrition. Now this is an important slide which I consider because I am going to talk about the first, primary prevention. Of course, prevention is primary, secondary and tertiary. To prevent the onset of illness or injury before the disease process begins. Secondary prevention is preventive measures that lead to early diagnosis and prompt treatment of the disease and prevent more severe problems to developing and include screening to identify diseases in the early stage. Tertiary is all about progression of the disease, more severe cause, which I am not going to talk about. So the preventive measures, the primary is the risk factors of obesity. Now I want to, you see, I have noticed in my practice, the majority, and you know, according to all the diseases. So majority of patients who fall ill and have kidney disease are those who are obese, who have high BMIs and all that. You take inadequate hydration. And then of course secondary is prevention. And here identify high-risk persons, manage obesity, improve glycemic control and BP control, avoid high salt diet, encourage healthy food and lifestyle. And I always like to keep the BP at 120/80 when it's possible. At least aim for 120/80 or 125/80. And if the creatinine is low, then keep a fasting sugar of 100, postprandial of 140, and a HbA1c of 6.
What is the batting order of your antihypertensives? What would you prefer first, second, third?
No, I use calcium channel blockers, all varieties, and I like to, if the BPs are very high, then I club it with beta blockers. Diuretics if there is edema. Of course, there's a lot of talk about combining chlorothalidone, but if it's early CKD, sometimes the creatinine can go up with chlorothalidone. So, of course, I use a lot of Ditor and all if there's edema. I know you're talking about chlorothalidone. Chlorothalidone can be given. If the creatinine does not worsen, you can give chlorothalidone.
ARB?
ARB is yes in the initial stages. Especially if the potassium is not rising on follow-up. And if there is a lot of proteinuria. Proteinuria, the only thing to combat proteinuria is ACE inhibitor. So you have to use Telma and all these if there is heavy proteinuria.
Do you have any specific choice between ACE inhibitor or ARB?
Or they're all the same.
They're
all the same.
I just want to ask you your choice, difference between using amlodipine vis-a-vis sildenafil.
Amlodipine I avoid because of ankle edema and tachycardia.
So in
I use sildenafil and penidipine and all these.
Yeah. So in CCPs,
I will avoid amlodipine.
Must avoid amlodipine. Thank you.
So we've spoken about primary, and I told them, I showed them the patient also who was, the way he was threatened by the doctors, my dialysis OB, and my focus here is how not to do dialysis, how not to do transplant, how to avoid it. So primary prevention of CKD, measures to achieve effective primary prevention should focus on two leading risk factors of CKD, including diabetes. These are our majority of patients. Yeah. Diabetes, obesity, smokers, lack of exercise, sedentary, foodies, gouging on food. These are our patients. targeting primordial risk factors of these two conditions, including metabolic syndrome and overnutrition, not undernutrition, overnutrition, is relevant to primary CKD prevention, as is correcting obesity. Promoting healthier lifestyle includes physical activity and healthier diet. Now, this is a very important point I want to make. More plant-based foods with less meat. मैं तो जहाँ GFR comes down, no animal protein, meat, chicken, fish. वो सरीन का स्लाइड, तो नहीं सरीन का एक मेरे घर पर. So I don't give non-vegetarian food,
including egg.
So I balance it here and there. Vegetarian protein, doodh, dahi, paneer, chole, everything, dals. People also say, even eggs and all those, they will say, dal, when will you dal khai? Dal is a third class protein, so you must eat it. So more with less meat, I literally give no meat. But yes, if the creatinine has come down very well, then I can start small.